are there any secondary effects that members of our audience might be afraid of, like GBS or any other type of syndrome?
Yes. There is no reason at this point to believe that there are going to be any more severe side effects from this flu than from the seasonal influenza. There will be a very careful surveillance going on to look for possible other side effects of this, and I don't think that at this point we have any other information.
Is there any truth? We've had some concern from some listeners that if you have any sort of flu or maybe a bad cold, you should go in and get tested anyway just to see if it's H1N1. Is there any point to that?
No. No, I think if people are sick and in a normal situation, they would be contacting their physician because of the seriousness of it. They should definitely do that. There won't be very much testing for H1N1 directly. It's a sophisticated test, and so there may be some testing to see if it's an A flu, an A flu strain, but there's no real reason to look specifically at whether it's H1N1 or another seasonal component or some other respiratory condition unless there's some specific medical reason. So I don't think there'll be a lot of testing for H1N1. There may be some testing for flu A, and most flu A will be H1N1. So but I don't think that it's not like you're trying to diagnose a disease to figure out what to treat it. In most cases, people will be able to treat this themselves at home, staying at home, a lot of fluids, taking over-the-counter medication for pain and for fever, making sure they don't go back to work or don't send their child to school until at least 24 hours after the fever abates or their symptoms subside. Because that's the way that most of us take care of our flu and other respiratory conditions, and there are a lot of other viruses that mimic what the flu does.